Caroline Shaw. I work here at the University of Otago in Wellington. I'm an epidemiologist and not someone who likes having their photo taken. Thank you, Luke. I'm going to talk about rethinking transport in the 21st century. I'd first like to acknowledge all the other speakers we've had this morning and how fantastic they've been, and it's been really inspiring. And I've learnt heaps, and so thank you very much to you all. Oh, that one. The big green arrow, okay. Here we go. Okay, so instead of thinking so much about our health system, what we're talking about, what I'm going to talk about today is a project that's looking at transport. So if we back up a bit and think about what determines health, sort of roughly about 60% or so is all the social, environmental and behavioural risk factors out there. And I'm particularly focused on transport, and what you can see there is a list of the ways that transport is both beneficial to health and also harms health. No one's actually ever been able to quantify how significant transport is for health in this country. Some of these pathways we can't really measure, but I would estimate that around 5% of deaths in this country are as a result of the way we've configured our transport system currently through pathways of air pollution, injury, and physical inactivity, but that is a back of the envelope calculation. The other link, of course, is through greenhouse gas emissions. So our current transport system, it produces health impacts, both good and bad, and it also produces transport sector greenhouse gas emissions. Somewhere around about 18% of our greenhouse gas emissions are through transport. And then because of the way our transport system is designed, that it's causing a whole lot of ill health, it's also causing the health sector to produce greenhouse gas emissions. And then, of course, we've got climate change looping back on that. So the greenhouse gas emissions produced are also going to cause further health impacts. If we think about the principles of a sustainable healthcare system, we've got the idea of reducing demand for healthcare, matching supply of health services to demand, not unnecessarily prescribing or operating on people, for example, and then reducing emissions in our healthcare services. And this project sits very firmly in that first part, a public health approach to reduce demand for healthcare. This particular project, which we're only partway through, it's quite nice to talk about it. I don't have to talk about results. There's no expectation. What we are doing in it is determining a range of plausible decarbonisation scenarios for the New Zealand transport sector. There are many different pathways that we can head down towards a low carbon transport system. I think that's been clear in some of the public conversation and documents this year. The Climate Commission's approach is quite different from what the Ministry of Transport has put up in terms of options. We're going to use an existing model to examine these different scenarios for quite a wide range of impacts, including health equity and greenhouse gas emissions. So just a little overview here. We're basically creating different scenarios, and then we're thinking about, well, what policies do you need to implement these scenarios? And then we're going to be modelling a whole lot of outcomes, transport, economic, greenhouse gas emissions and health, and looking at equity impacts of them. I think it's useful to think about what a scenario is and why we do them, because we've talked a little bit about visions and scenarios in some ways today. And they're quite a tricky thing to do in some ways, because we're often so embedded in our current system. It's really difficult to see that things could be completely different. And so one of the really important functions of coming up with different scenarios is that they bridge this imagination gap between what we've got now and what might need to happen. Also, they provide a window into the current system's values and assumptions, because we often assume that what we've got currently is value free. It's just the natural way of doing things, and that's just not the case at all. How do you come up with a scenario? This is something that I spent a lot of time thinking about last year. There's big formal exercises you can do, this idea of visioning exercises, and I've included a picture from one that was done visioning cycling and walking in England and Wales a few years ago. You can take something that already exists, some policy goals or targets, or you can just make something up, and the latter is probably the most common thing that people do. What we decided to do for ours is we've got two separate processes going on. We've got a process led by our the Māori members of the team and also advisory group developing a scenario of what a transport system that achieves the aspirations of Māori might look like. And then we're going to look at two other scenarios, one of which is the Climate Commission approach, which is heavily focused on electric cars. And then we're going to look at a scenario where our transport system, one of its primary aims is to improve health. So all decisions around the transport system are filtered through a health lens. So for example, our speed limits would automatically drop really significantly in both urban and rural areas. We might put restrictions on the weight of cars that are imported into this country, a whole lot of things like that, which probably are politically difficult to talk about, but nonetheless we will anyway. And then we do this work specifying the scenarios, really detailed process, and then also the other thing we're thinking about while we're doing that is about how we'll communicate them. So we're looking at once they're finished, we'll get some visual images of them drawn up to help people really see what a different transport system might look like, see where people fit into it, see how what your life might look like if we had a different configuration of transport. The next bit of work we're doing also is thinking about all the policies that you need to implement each of the scenarios. There's things like land use, cycling policies, we might think about restricting cars, that kind of stuff, and the combination of them is different for each scenario. So we have to figure out what the combination is for each scenario and then look at what the evidence says about how well they work. What might be kind of a reasonable estimate of how well they work. And then we're doing our modelling, which has got these 4 components around transport costs, greenhouse gas emissions and health impacts, and I'll just briefly go through that. Some of the transport things that we're looking at are things like vehicle kilometres travelled, the mode that people use, do they cycle, do they walk, do they take cars, speeds that people are travelling, and distribution of the changes of these things. We will be aiming to look at how much some of these things cost to implement. So, for example, how much does it cost to deliver networks of cycleways versus other types of infrastructure for public transport? And then we'll be looking at the health system costs. And actually often that is health system savings for some of these scenarios. Which scenarios will result in the biggest emission reduction and also the fastest? So we can have a play around with those sorts of things, because actually the speed can be relative as important as well. And then the things that we look at in terms of health, physical activity, we're going to be looking at air pollution, which is potentially a bigger issue than we had historically thought in this country. We'll be looking at road injury. We're also going to be trying to look at noise, which is something that we haven't looked at previously, but we know it's linked to cardiovascular disease relatively strongly, and that the transport system contributes a lot to noise. We also want to try and include mental health impacts, which we haven't got in the model currently. And then what you do at the end, because you can end up with all these different types of measures of disease, is that you convert them all into a common metric, which is this thing called a health adjusted life year, which sort of doesn't mean much when you're talking about it between the two of you. But what it does allow you to do is compare across these different scenarios of how many health adjusted life years we might save or otherwise. And then obviously I am not doing this alone. I just wanted to acknowledge all the other people who are working directly on this project. Rhys Jones, who may or may not be on Zoom. Tony Blakely and Alistair Woodward, and here in Wellington, Mel McLeod, myself, Ryan and Anya Misdrak are all working on this. And we are supported by a fantastic group of advisors from health and transport sectors who are supporting us to do this work.